Well, to discuss this further, I'm now joined by Government Advisor Shadim Hussain. Shadim, many thanks for joining us this evening. Let's look at both ends of the spectrum then, on both young and old. The government seems to be at odds with public opinion, doesn't it?
Absolutely, yeah. I mean, you know, we're in unprecedented situation here. It's a state of emergency, and obviously the reactions that we're seeing from other governments and other countries, at the moment the UK seems to be out of sync. Of course, we are following the advice of medical advisors, and we've got to stick to the protocols that have been put into place.
Well, judging by the statistics, it seems that children, they don't seem to be at risk as much from coronavirus. So, in a way, isn't shutting schools counterintuitive?
Well, essentially, what we do recognise is that the children are the carriers. So what's been seen so far is children under the age of 10 are the least likely to be affected from this, even though they may be carriers. But when they come back into the household, when they're mixing with adults who are vulnerable, there is a serious risk of that contagion passing on to those who are more vulnerable.
Well, then, sending kids home means that the parents also stay off work as well, as we were hearing in some of the facts and figures there. Doesn't that then have an impact on the economy and also a lot of the workers that work in the NHS?
Absolutely, it will have a direct impact on both healthcare and social care. And this is a major concern for us in the social care sector, because essentially those relationships that look after children and adults can't be replaced very easily. And it is a risk factor where the government is advising people to isolate for 7 days. But what do we do when we're in a situation where we're caring for somebody and there isn't a direct replacement?
Indeed. I mean, it's often, isn't it, the grandparents that look after children if they come home from school or if they're off sick. But aren't they then put at risk if kids spend more time with them?
Absolutely, yeah. And of course, you know, here we're talking about, you know, biological relationships. What we also have to consider is foster care. You know, what happens in a situation where a foster carer becomes ill? What happens to that child? And it's not easy to replace that individual. You know, these relationships are born out of care and love and affection. It takes time, and quite often these children are already in an emotional state where they might have faced other challenges in their life, and to have to go through this trauma again can have a very serious negative impact on their health and well-being too.
Well, indeed, as you say, vulnerable children, also older people as well. They're also at risk if we go to the other extreme, if we isolate people too much, aren't they?
Yes, absolutely, absolutely. And this is, of course, something that's been discussed, you know, across different sectors. If you look at the messages across Twitter, there are many concerns, and the reality is that unless we put some concrete investment into social care immediately, we're going to see a real free-fall. It's absolutely fine, the NHS needs the money, but what we must understand is that the NHS works directly hand in hand with social care. What we're talking about is social care to do with nurses visiting people's homes, elderly care homes, residential care, foster care. These are all areas that are impacted, and we're already in a situation where for the last 10 years, due to the austerity measures, there's been massive underinvestment. You know, we currently have a shortage of maybe 7,000 to 8,000 foster carers in the UK. We also have an ageing population of foster carers, so it's not something that can be quickly fixed. You know, more recently we've been discussing the need to put back marketing campaigns. This coming Friday we had a Foster Friday campaign, a national campaign that was taking place. That's had to be postponed simply because we don't have the resources in place. There's a risk that our staff from local authorities across the country may be off work. And this will have a knock-on effect, and it will probably take years for us to recover from this.
Indeed, and worrying thoughts there. Shadim Hussain, many thanks for joining us. Thank you.
Thank you.